Good morning, good afternoon, and good evening to everyone across the world. Welcome to our global conversation on a very deeply significant theme and topic today, that is cultural approaches to mental health. Mental health is often framed as a medical or psychological issue, but the truth is, it is just as much a cultural and social phenomenon. How we feel, express, and respond to emotional distress is influenced by our values, our traditions, our families, even our music and spiritual beliefs. So today, we bring together voices from different parts of the world, from Brazil to Japan, and perspectives of the youth who are shaping the future to explore how cultural influences mental health, treatment, care, and healing. So, why this webinar? Because in order to truly support mental well being, we must first understand how people define it culturally. Only then can our care be respectful, relevant, and transformative. I am Dr. Roshni Jhan Ganguly from India, a family physician, your host and moderator for today's session. Thank you all for joining in today. So we'll make this session, interactive, interesting, musical, and lots more culturally. On that note, I would like to start with an icebreaker question. So as mentioned in the chat, everybody, all the participants, I would please request you to type in menti.com on your phones or laptops from wherever you're joining and type in the particular code. That is, I'll call it out. It's on the chat as well. And our communications officer, Mr. Diamoid, has already sent it, but I'll just call it out. It's 2404 0354. So I shall be sharing my screen now. So here is the question, and everybody types a word, and this will show like a word cloud. Let's see that in one word, what does mental well-being mean in your culture? Can all of you please type your own words? Any one word. All right, stability, that's wonderful. Happiness, okay. Let's have more people coming in. Fruitfulness, wow. There you go, it's all coming in. Lovely. So we have hope, peace, fruitfulness, stability, right, happiness. We have two happinesses. Focus, luxury. That's interesting. And resilience, peace, light. Wow. So here we see the different aspects and the perspectives coming out across the world that some feel, okay, mental well-being is just simply happiness. Some feel that it is a luxury. Some feel that it's very much required for stability. It is fruitful. It brings in tranquility, hope, resilience. So wonderful. Thank you so much for contributing. And we shall move on without further ado to our first speaker. It is my privilege and honor to introduce to you Professor Alfredo de Oliveira from Brazil, a professor in the Department of Primary Health Care, Federal University of Rio de Janeiro. He is the lead of WONCA's Music and Mental Health Project. Welcome, Professor. The stage is yours.
Well, good morning, good afternoon, good night for everyone. Let me share my presentation. Well, I'm glad to be here. Oh, thank you to be with you. And thank you, Jeremud, for coordinate this webinar. As Roshni said, my name is Alfredo de Oliveira Neto. I'm a family physician and professor at Federal University of Rio de Janeiro and member of the WONCA Working Party on Mental Health. Well, we have known about the benefits of the relationship between music and mental health since the mid 20th century. Listening to music activates the amygdala, hippocampus, and nuclear accumbens, regions involved in emotion, memory, and reward. Singing requires and conveys breath control, vocal tone, timing, and intensity, all of which correlate with emotional states. Singing engages two bilateral brain networks, including the language and emotional centers of both hemispheres. Group singing can enhance mood, reduce anxiety, and improve the quality of life for diverse populations, including trauma survivors and individuals with cancer. Emotions evoked by music often bypass the analytical filters of the frontal cortex, allowing us to directly access feelings that may be difficult to articulate. Therefore, for some patients, singing or playing music may be more important for psychotherapy than just talking. Caregivers reported feeling more connected to patients after participating in the music-based sessions. On the right, it's a cartoon about the Brazilian band Harmony Gets Crazy, which I'll talk about in a moment. It is already known too that as adjunctive therapy, music, when used clinically, produces improvements in these mental health conditions: depression, autism, schizophrenia, dementia, anxiety, sleeplessness, and substance abuse. Well, the Music and Mental Health Project emerged from conversations at the WONCA Working Party for Mental Health, from the challenges posed by the pandemic and the need for productions of virtual projects. In addition to being a family physician and professor, I have 17 years of experience playing a band that brings together mental health patients and health professionals, called Harmonia Enlouquece, Harmony Gets Crazy in English. A band that is a symbol of the Brazilian psychiatric reform and will complete 25 years in 2026 next year. We are finalizing the 5th album of original songs. At the time, with the help of Chris Dorick, chair at the time of the WONCA Working Party on Mental Health, I designed the project aiming to map similar musical groups around the world, if they exist or not, in order to get together and try some remote musical productions. Here, the contact of Harmony Enlouquece. Was the Google Sheet extracted from the Google Forms that we share with key people on every continent. And we got 30 groups, 14 different countries, 5 continents, and WhatsApp group was created and first meeting 2020. The objectives of the projects were and are help to reduce psychosocial suffering, expand the visibility of the experience, promote meetings, stimulate collaborative musical productions, stimulate new experience, divulgations, class, conference, film festival, verticals, chapters, etc. And what did we do in the beginning? Well, we did a webinar. After setting a WhatsApp group, we had some meetings, and we combined in 4 initial productions: a webinar with 3 music mental health experience, Brazil, Australia, and India, a sing-along video calling for that webinar, a song composing a song about psychosocial suffering in the pandemic, and a video clip of the song. Indians, Brazilians, and English composed the song, and the Filipinos did the video clip. On the left, the poster of the first webinar. Here is the sing-along. Here comes the sun calling to that first webinar.
Here comes the sun, doo-doo-doo. Here comes the sun,
and I say it's alright.
Little darling, it's been a long, cold, lonely winter.
Little darling, it feels like years since it's been here. Here comes the sun, doo-doo-doo-doo. Here comes the sun,
and I say
it's alright. It's alright. Sun, 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 here it comes.
And this is the tone of mind, is how it calls the song, the video clip of that song that we composed.
I know the rhythm of my own does not beat so nice if alone. When sun points at the dawn, this is the moon when it's gone. Sadness rise to the sky, atop of the high to the fall. Tonight I'm gonna call that friend of mine whom I love. How far distant our hearts, shattered in hundreds of parts. But I'm strong-willed like you, pick beat by beat, it's a news. Don't live for later, feel side by side. Love is the greatest tone of my mind. Earth's rounding, it turns, breezes all over around us. There's no time to discuss, love is glad to return. I know the rhythm my own does not beat so nice if alone. Sadness rise to the sky, atop of the high to the fall. Tonight I'm gonna call that friend of mine whom I love. There's no time to discuss, love is glad to return.
Those final images were made by these artists. They were mental health patients revealed by the psychiatrist Nise da Silveira, who introduced art therapy in Brazil in the 40s. Those artists are now recognized in the art world. And what do we continue to do from then on? A documentary with 4 music mental health experience, Brazil, India, South Africa, and Australia, that we completed last year, 2024. An article in British journal General Practice Live, and a sing-along video for 2025 World Family Doctor Day that were released yesterday. On the right, WONCA news about the project. We had 2 WONCA news about. And why not a documentary? During the webinar, we watched the trailer of the documentary by the Australian band The Desert Stars. It was very impactful and inspiring. The documentary is called Graver Road and was produced and directed by Tristan Pemberton, Australian. Film that just won a Best Documentary award at Pop Jasper International Film in California in 2023. Thinking about the next step, I found the possibility of selecting some groups already mapped and produce a documentary about the daily life of these projects, their stories, their songs filmed by themselves, and I called Tristan Pemberton to direct. The documentary is also called Tone of Mind, and as I said, was finished in 2024. We haven't released it yet. We tried to have it released at the opening ceremony of the 2025 WONCA World Conference in Lisbon, but so far we haven't had any success. If anyone is watching and could help us, please send a smoke signal final. Here, and how we did it. The production took 2 years. After meetings with Tristan Pemberton and the chosen groups, we defined the script, how and what each one would record, and who would be responsible for the recordings. The groups were Harmony Gets Crazy, which I have already mentioned, the Desert Stars from Chunchunchara community in the remote Great Victoria Desert region of Western Australia. This band claimed the title of the world's most remote rock band. Formed by First People of Australia, Chunchunchara community has a primary healthcare service, and our bridge was Drew Benson, family physician and professor. The next group is Know Your Rhythm in India, a training program created by Arnab Vishnu Chaudhary. It blends music therapy with yoga therapy, helping participants discover their own sense of rhythm while raising well-being. Based in Pondicherry, south of India, over the past 10 years, Know Your Rhythm has also engaged over 20,000 global caregivers from healthcare, including COVID, wellness, special education, and management. And Leslie Kubeka from South Africa, a primary healthcare professional and classical opera singer. She currently serves as a qualified health promotion officer in the health research fraternity. In 2020, Kubeka won the Sarah Walker Prize in the Voice of South Africa International Singing Competition. So we got those 4 incredible experiences. Here, our article that we published in 2025. And now the sing-along that we did, Dear Mood produced too, and we released it yesterday to the World Family Doctor Day.
Don't worry about it, thanks. Cause every little thing gonna be alright.
Don't worry about a thing. Everything is gonna be alright.
Woke up this morning, smile with the rising sun.
Three little birds sat on my window,
Singing sweet songs.
don't worry about a thing.
Every little thing is gonna be alright. Sing it, don't worry about a thing.
'Cause every little thing is gonna be alright.
Sing it, don't worry about a thing. Cause every little thing is gonna be alright. Don't worry. Don't worry. Don't worry.
Don't worry. Don't worry. Don't worry.
Bravo! Bravo, bravo! No quiero ver eso.
Well, that's it. Thank you. Yeah, here are the QR codes and my contacts. Thank you. I'll stop sharing now.
Thank you, Professor Alfredo from Brazil. I mean, what a lovely session we had, and I think it was creating mental resilience for all of us. And it indeed showcased that a passionate advocate of integrating culture and art into healing, and how this kind of music therapy really intersects with mental health was just shown, on live by you. So thank you so much. And what a powerful reminder that healing is not always through words, but often through rhythm and resonance. Every part of your presentation, what areas of the brain it stimulates, how the caregivers benefit, how it can be used as adjunct therapy, your projects. And I think it's a golden opportunity for people attending and people who are, interested in music, that the documentary offer which Alfredo is giving us, I think we should all contribute in our best possible way. Thank you very much once again. Now, moving on to our next speaker, so we travel from Brazil to now Japan, where Dr. Masahide Koda will take us into a more data-driven exploration. He will share results of a fascinating survey of public attitudes and beliefs towards mental health in Japan and how centuries-old cultural ideas influence people, perception, and treatment. Welcome, Dr. Masahide Koda. The stage is yours.
Hi. Thank you for your kind introduction. Good morning, good afternoon, good evening, everyone. I'm Masahide Koda from Okayama University and the Japan Primary Care Association, where I serve as Vice Chair of the Mental Health Committee and Chair of the Committee of the Disaster Health System. Today, I'm honored to share insights from our work on public attitudes and beliefs about mental health in Japan and how centuries-old cultural ideas continue to influence both perception and treatment approaches. I'd like to begin by highlighting what I hope you remember from today's presentation. Cultural approaches to mental health in Japan. Culture of shame hinders psychiatric care access. Primary care providers serve as essential gateways. Disaster preparedness is crucial in Japan. What's impossible in normal times remains impossible during crises. Let me start with a traditional Japanese proverb that beautifully illustrates our cultural understanding of resilience. Willow does not break under snow. In Japan, strength is often discussed as a virtue, but the essence of resilience isn't rigidity, it's flexibility. This ancient saying teaches that while thick oak branches might break under heavy snow, willow branches bend gently to shed the snow before returning to their original form. This wisdom shows that true resilience combines both flexibility and strength. Japanese martial arts teach that softness overcomes hardness, and modern mental health approaches similarly emphasize cultivating a flexible mind rather than rigid toughness. The ability to bend without breaking, to temporarily yield under pressure and then recover is essential for navigating today's rapidly changing world. Like heavy snow, various challenges burden Japan's mental health landscape. In 2013, mental illness was officially added as one of Japan's 5 major diseases, alongside cancer, stroke, heart attack, and diabetes. A pivotal shift recognizing mental health as a national priority. 1 in 5 Japanese people experience mental illness in their lifetime. Suicide remains the leading cause of death for males ages from 20 to 44. And post-COVID-19, depression prevalence doubled from 7.9% in 2013 to 17.3% in 2020. These statistics must be understood within Japan's cultural context. We have a pervasive culture of shame and stigma that surround mental illness. Traditional virtues of endurance and silence discourage seeking professional help. As a result, help-seeking behavior remains remarkably low, with only 6% of Japanese using psychological counseling in their lifetime. This cultural backdrop means many people suffering from mental health conditions remain hidden and untreated. Given these cultural barriers, primary care physicians play a crucial role. Research by Dr. Miki in 2002 found that among patients with depressive symptoms, 64.7% first visit internal medicine doctors, while only 5.6% initially consulted psychiatrists and 3.8% visited psychosomatic medicine. Most notably, 90% did not see a psychiatrist or psychosomatic medicine at their first medical visit. This pattern demonstrated how primary care physicians serve as essential gateways to mental health care in Japan. In 2021, the Japan Primary Care Association conducted a survey on mental health care in primary practice. The findings were striking. We discovered that 98% of primary care physicians saw at least one patient with mental health problems in past month. And over 70% of primary care physicians are actively involved in caring for people with dementia, anxiety disorders, and depression. This data confirms that mental health care is not separate from, but integral to primary care practice in Japan. To strengthen this crucial role, the JPCA established its mental health committee in 2020 with three strategic pillars. We are focused on building stronger collaboration with mental health professionals, providing training and empowerment of supervising physicians, and developing and implementing support system. In 2023, we published recommendations for training goals and strategy for mental health competencies in the new family medicine specialist program, establishing concrete training objectives for diagnosis, pharmacotherapy, psychotherapy, and crisis intervention. We are also creating on-demand learning resources, hosting regular case conference, and developing practical tools like our CBT for insomnia in 5 minutes seminar to support primary care physicians. Understanding Japan's approach to mental resilience requires recognize our status as a disaster-prone nation. Frequent earthquakes, tsunamis, and typhoons create ongoing trauma and long-term mental health issues. In these crisis situations, primary care physicians become even more critical, supporting communities when specialized facilities are damaged and reversing established patient relationships to provide continuity of care. Our Committee of Disaster Health System emphasizes fundamental principles. Preparedness in normal time is preparedness for disasters. We focus on building resilient healthcare systems that remain functional during crises, implementing a proactive disaster risk reduction approach rather than merely reacting to emergencies, and training primary care physicians to maintain mental health support during disruptions. In our disaster response training, we emphasize the UN-endorsed MHPSS framework, which recognizes that effective mental health support extends beyond clinical service. This includes social consideration in basic service and security, strengthening community and family supports, focus non-specialized person-to-person support, and specialized services for complex cases. Primary care physicians operate across multiple levels of this pyramid, helping to preserve the social fabric that supports mental resilience even in crisis situations. To conclude, I'd like to share another profound Japanese concept, kintsugi, the art of repairing broken pottery with gold. This 15th century practice embodies the philosophy. The breakage and repair become part of an object history, rather than something to disguise. The gold-filled cracks highlight rather than hide the damage, creating something more beautiful and valuable than before. As a metaphor for mental resilience, kintsugi reminds us that our wounds and challenges can become a source of unique strength and beauty. In disaster situations, we often witness what psychologists now call post-traumatic growth, positive psychological change experienced as a result of struggle with highly challenging life circumstances. Beauty in imperfection, every crack becomes the story. In summary, I'd like to emphasize two key points about cultural approaches to mental health in Japan. First, our culture of shame significantly hinders psychiatric care access, which is why primary care providers serve as essential gateways for patients seeking mental health support. Second, disaster preparedness is absolutely crucial in Japan, because what's impossible to accomplish during normal times remains impossible during crisis. This reality shapes how we must approach both everyday mental health care and emergency response in our communities. That brings me to the end of my presentation today. Thanks for your attention.
Thank you so much, Dr. Koda, for the insightful look at the intersection of, tradition, stigma that is present in the society, and your preparedness for any disaster in a normal situation. So I think your points reiterated, and showed us that one very interesting thing, that 90% of the patients did not see a psychiatrist, and that is very much linked to the social stigma, and that our role comes to the forefront as primary care physicians, as family physicians, is so important. I also really liked this concept which is coming up, like the post-trauma support care, and how you were prepared for it in case of any kind of disaster, and because that really impacts us, our mental health. So thank you for highlighting all that and bringing that out. Thank you very much.
Thank you.
So now moving on to the perspective of the youth, and we have two very fantastic and youngsters. That's Anna Liakopoulou from Greece and Zain El-Mikati from Egypt. We'll begin with Anna, who is the IFMSA Liaison Officer for the Medical Research Sciences and Research Issues. She will be highlighting her perspectives, and we are very eager to hear you, Anna. Over to you. Thank you.
Perfect. Thank you so much for the introduction. Thank you everyone for being here. I want to mention that I'm really happy to see people from Greece. So we're gonna do a very brief introduction for IFMSA, and then we'll move on to the perspective of medical students on mental health and the mental health of medical practitioners. If there's any background noise, let me know so I can speak up, because I'm in Geneva for the World Health Assembly, and it's a little bit loud in the Palais, but we will also try to include some news from what's happening here on ground in our presentation. So I hope you will enjoy it. I'm here with Zain. He will continue to tell you more about our work in IFMSA. So we can start. Perfect. So basically, IFMSA was first it's from since 1952. So a couple of medical students from different countries came together, and they were like, we have to do something international. There is now WHO, there are all these things. We're like post the Second World War, and we have to do some work on public health and maybe even have some exchanges programs. So we have an exchange program since that year, and basically want to build capacities for medical students on different topics. And of course, one of these topics is mental health that we'll discuss a little bit later. Next slide. So as you can see here, we're 1.5 million students. We have a lot of alumni that are working in different organizations, in WHO, in their country ministries, and of course, a lot of them are doctors. And we have a lot of more than 10,000 students going on exchange program each year. Next slide. Perfect. And we have the structure of WHO, so 5 regions: European region, Eastern Mediterranean, Asia Pacific, Africa, and Americas. And our main structure is these six like standing committees. Basically, it's like six focus areas: medical education, SRHR issues, sexual and reproductive health, professional exchanges, which is also medical sciences. This is like where I mostly work on, and research exchanges again is also for research issues or like research education for medical students. And then we have public health and human rights and peace. So under public health, it's also mental health, but of course it is a right for people to have mental health. So it's also under like the human rights, and we try to work on that from both perspectives. So how we can provide mental health to people, but also how can we advocate for this, because it's something needed and something that sometimes we forget ourselves as doctors that is needed for us, and we try to provide it for other people. And I think also in primary healthcare settings, this is even more an issue, because we get to see the patients every day. We get to have like this contact with them, and then we kind of like forget about our like maybe taking care of ourselves as well. Next slide. So some data about mental health of youth, what's happening there in that field, you know? So I'm sorry, 1 in 7 adolescents globally experience mental disorder, and this is in total accounting for 15% of the disease burden. Mostly it's depression, anxiety, and of course this has been even a bigger issue during the pandemic, but maybe it has been also a way to kind of focus more on that and try to see what can be done. And for 34% of the adolescents that are clinically, they have clinical depression are females and youth in the Middle East, Africa, and Asia. These are the most affected continents. So maybe this is like the areas we also need to take more action. And another issue that there is no early intervention in most cases, up to 70% of the cases. This is from both sides, I would say. Probably also we as youth sometimes are reluctant, and we're not really sharing what's happening in our minds, mostly maybe in puberty. So we're not really gonna start for struggling. But on the other hand, it's an issue of the structure of our healthcare systems and how we transition from being a child to being adolescents and like being young adults. And there is like a little bit of weird follow-up on that, until at least I guess in Greece, because we have our family doctor, but the pediatrician, and then we move on to the family doctor. And there needs to be a follow-up that maybe sometimes is not happening there. And next slide. Sorry. So a lot of the times we get to go to the hospital as medical students, and this is the reality that we see. There is the doctors there are not getting any support, or they feel that they don't need any support, although that they're having difficulties with their mental health, and they accept it as the situation. They say this is how it is, and a lot of the times they kind of prepare us, you know, this is going to be your future, you have to be strong. It's good that you see it now and you're getting prepared, that basically you won't have any mental health. But if we just continue to normalize the situation, we're not going to tackle it, and we're not going to change anything from the perspective of healthcare practitioners, and how we should also take care of our mental health in order to be able to take care of our patients. There are no role models most of the time of doctors that really try to take care of themselves in that aspect. And it's not because they don't want to. Most of the time is because there's no support, there's no infrastructure. There aren't the correct mechanisms for them to receive the support on the limited time and the specific environment that they're in. And from now, I will pass it on to Jane to tell you a little bit more about our thoughts and how medical students have tried to tackle these issues a little bit. Thank you so much.
Thank you so much, Anna, for this very interesting perspective and really setting the gateway for our efforts and what youth generally face as with mental health problems. Hello, everyone. My name is Zainuddin El Mitati. I'm a fifth-year medical student from Egypt, and I'm here on behalf of the Standing Committee on Public Health, where we do work a lot in the mental health aspect. So, let me just go over our stance really, and it really resonates with the topic of this webinar. We really aim as IFMSA and as youth to connect traditions with best practices. You know, some of the hardest ways to combat mental health and tackle mental health is facing these barriers of beliefs and obstacles of the mindsets of people. So respecting the beliefs while also applying proven mental health methods that are scientific and evidence-based will really let us, create more impactful activities. Also, leveraging online platforms and starting conversations through social media has been proven to really set the path for more discussions on this topic. And of course, hosting peer-led support circles where we can create safe spaces that are student-run, either online or in person, for sharing and for growth. And this in all helps build empathy and mental health skills, where we provide simple tools where every youth can utilize in their own fields to reach better mental health and recognize their needs. This all is our stance when it comes to mental health. And through this, we have done a lot of efforts to, tackle mental health, from on-ground activities to high-level discussions and advocacy. So let me go through it right now. So the first thing is that we have a centralized program called Mental Health Program. And this is one of the 13 programs of the 13 focus areas we have. And what this program is, it's basically a global database, a streamlined database of activities of our national member organizations across the 5 regions that Anna mentioned. And since 2017, we have 278 initiatives enrolled and active into this program. This means that all over the 120 plus countries, 278 initiatives are working on the ground on mental health initiatives. And this year, we have 19 new activities covering topics from peer support to digital well-being to suicide prevention and lots of other mental health focus areas. Let me show you a glimpse of these activities as well. So here we have an activity called Inside Out initiative from Croatia, and this tackled mental health and peer support. As you can see, we create spaces where students can actually engage in these discussions otherwise not covered in our medical curricula. And then we have from Hungary, Sober November, where they tackled addiction and alcohol consumption as well as part of their mental health initiatives. We have Fearless, an activity from Indonesia that did mental health screenings on elderly populations in rural areas in Indonesia. And then we have from Oman, the Mexico Night, which basically covered mental health initiatives during the month of Ramadan, where they explored the interconnectedness with spirituality and mental health. So as you can see, we really cover a wide range of regions, wide range of cultures, and that's the power of youth. And that's why youth need to be centered and focused in these discussions. Now let's move on to our efforts in capacity building. IFMSA has an international certified mental health essentials training, which is abbreviated as MHE. So our members can participate in these trainings where they focus on the foundations of mental health literacy, and it's mostly interactive workshops, including role plays, case studies, skill building exercises. And in return, they get certified as being facilitators, and they can relay this information in their own countries, which is the power of what we have here at IFMSA. It's peer-to-peer training, and it continues. It's like a ripple effect that continues throughout multiple cultures, and it's adapted to their own contexts. Next, we have awareness campaigns. So because we work on the public health aspect as well, we always do annual campaigns on key mental health days like World Mental Health Day and Mental Health Awareness Month, which we're currently in. And we always are keen to invite global experts and also center the discussion around youth, showcasing their efforts, their activities, so we can learn from each other. And also we have two very interesting webinars coming up. So I urge you to follow IFMSA's socials on Instagram, LinkedIn, and everything to kind of follow up with that. You could see we have a webinar called Mind the Gap on community driving mental health impact, which is on May 25th. And also we have various access in mental health in the Eastern Mediterranean region, and that's on May 30th. So definitely mark your calendars for these events, and we will happy to share them also on our socials. Next, we have external collaborations and advocacy efforts. The IFMSA works a lot with the WHO Mental Health Department, and we have alliances with other organizations like United for Global Mental Health. And we're happy to be here as well with WONCA, where we've worked a lot with WONCA, and I'm happy the conversation is starting to center around mental health as well, which is great. Also, in our last General Assembly, the IFMSA adopted a policy document on mental health for all, which covered a wide range of call to actions and discussions around the importance of mental health integration, especially in primary healthcare. And also, we are delivering statements of the World Health Assembly, so definitely watch out tomorrow, agenda item 13.2, where IFMSA is going to be delivering a very amazing statement on mental health, which was drafted by our amazing liaison officer, Anna, here. So definitely stay tuned for that. And with the upcoming high-level meeting on NCDs and mental health, we're also preparing lots of interesting initiatives so we can really put youth in the center. Health is usually neglected, and even though in discussions of health, it doesn't include youth as much as we want to. So putting youth at the center of health and health at the center of every discussions is very, very, very important. So this is the end of our presentation. I hope you enjoyed this discussion and really realized the importance intersection here of youth and mental health, and why it's important to really put youth in the center and talk more about mental health, whether in your communities or on a global level. So thank you so much for having us, and looking forward to any questions if anybody has them.
Thank you so much, Anna and Zain. You've really been the voice of the youth across cultures, and and you've showcased that how you're challenging, redefining, and navigating through mental health with digital openness, with peer communities, and with global solidarity. So thank you very much for that. It was indeed very, very enlightening. And you've again reiterated, I think, that, sometimes being judgmental, sometimes just the stigma of mental health, how we normalize the suffering, how we internalize our, stigma and silence that even among us doctors, youth, everybody, because under the pressure, we tend to do that very often. So it's very, very important that we seek help at the same time. So thank you very much. So moving on to the question and answers, we have about maybe 3-4 minutes more. If I just check if there are any questions, and I think everybody is applauding all the speakers for their wonderful presentations.
If anybody has a question, we can invite you to use the raise your hand function on their
yeah.
I think it's enabled, and I can come to you.
So since we don't see any questions, yes, Alfredo, you've raised your hand. Do you want to say something, please?
No, just to thank the presentations of Masahide, Koda, Anna, and Zain. I'd like to know, Koda, how family physicians there in Japan work when there are disasters in the area of disaster. Do they spend time living there to help people? And what is the frequency of disasters in Japan? 1 per year, 2 per year? How is going on there?
Thank you for your question. Frequency of the disaster in Japan is sometimes very various disaster. You know, the earthquakes or the most recent earthquake occurs the 2020 the January in Noto Peninsula earthquakes, and the former is the 2016 Kumamoto earthquake, and then various disaster occurs, and the Japan Primary Care Association organized the primary care association teams since 2011, the Great East earthquake, and the after that, 2023, the formal organized the primary care association assistance team. The team help the affected peoples to the support the medical clinical and the affect we aim to we aim our aim is the empowerment of the affected people and empowerment their resilience to smooth to recovery their community health. Yeah, so we help to and based on MHPSS, mental health and psychosocial support, and not only a special clinical support, but also the basic life support or the social connective support. Yeah.
Thank you.
Right.
Yes, thank you.
I had a question for Professor Alfredo, regarding the projects that you're doing. Since so many people are here, I am personally keen to, join the project. So people who are really want to join the musical project and how it, affects mental health, what is the procedure? Do we have any form that we can fill, or would you share any information with us? That's one. And second question is regarding the documentary. If anybody is interested, how do they apply for it? Thank you.
Okay, thank you. Well, proceedings to get into the project now. The project belongs to the WONCA Working Party on Mental Health. So, but people from outside can enter too. Many people already has organized some products of the project since the beginning. But it doesn't have a Google form to enter. I think you have to contact me in the record webinar. There will be my contacts at the final of my presentation. You can contact me by email or by WhatsApp, and please maybe every time that we finish a cycle of the project, we think, okay, the project is end, and let's do something in another area, in another field. But somehow people ask, and let's do something, let's do another thing, let's don't stop. So we are going, okay? So please contact me and we'll
Right.
talk about it. About
Thank
the
you so much.
documentary,
Yes.
we want to release it. I don't know if I go to Lisbon in September, but we're trying to only 15 minutes. It's mid doc, you know, and it's a mini doc, and I'm trying to release it. And after releasing it, it's from WONCA, the documentary. So will be, Dear Mood will help us to put in the social medias and WONCA site. Okay.
Right. Thank you very much. Thank you for that. Any other questions before we wind up? Well, in the interest of time, I think what a wonderful session, and I'm truly privileged to have been the moderator for this session. Thank you to each one of our panelists, and this was indeed a journey across continents and generations and cultures. So I thank you all for your patient hearing, for the wonderful presentations. We have a lot to do together. We have miles to go before we sleep, and looking forward to many more. So thank you very much, and have a great day, great evening. Thank you.
Thank you, Roshni. Thank you, everybody.
Thank you.
Thank you.
Much.
Thank you.
Thank you,
Bye-bye.
everyone.
Bye.